All right. Good evening. I'm Dr. Taylor.
Hi,
Um,
Danny.
I'm Danny, and this is our Westbury conversations. We don't know how often we'll do this, but Dr. Taylor is going to help guide us on how to manage stress, anxiety, and fear through this pandemic. I wanted to share a little bit about how lucky we are that Dr. Taylor is joining us. She is the assistant professor at the Department of Psychiatry and Behavioral Sciences at UT. And her clinical interests are anxiety, depression, individuals coping with health issues, grief, women's health issues, and stress. And her primary treatment orientation is cognitive behavioral therapy, so it fits really well. And she earned her doctorate at the Center for Anxiety and Related Disorders at Boston University, so it fits really well with our topic. What I appreciate is that the way she describes the way she treats patients, she considers herself to be a people builder and tries to help patients utilize their existing strengths while also teaching new approaches and tools that can be utilized to decrease distressing symptoms while enhancing quality of life and functioning. And I'm thinking new approaches and tools is probably what we're all trying to figure out right now.
Yeah, I think that's the case for a lot of people. And I think sometimes we're just going to pull up some of the tools that we didn't even realize that we had. So thanks for having me. And I wish the circumstances were different, but I'm happy to be here and talking to you about this.
Thank you. I'm going to open in a word of prayer, and then I had a few questions jotted down, and then we'll jump in.
Okay. Okay.
Gracious God, we give you thanks that we are not alone and that you are with us. And God, we pray that you bless this time where Andrea and I have a chance to talk, and pray that you speak wisdom to all of us as we listen to what Andrea has learned through all her years, all her experiences, and how she can with her gifts, apply this to a situation none of us ever imagined. Be present with us, be present with all who are listening in now or in the future. We pray this in your son's name. Amen.
Amen.
So Andrea, I was going to ask first, how does everything happening in the world affect our mental state?
Good place to start because I think unless you are living in a bubble or you are already living on a ranch in the middle of nowhere, by yourself and self-sufficient, you can't help but be impacted by what's going on around us. And that happens every day, but particularly when something this big and this world changing is going on. Now, everybody is going to respond in different ways and in different ways over time. But again, especially as we're talking about the impact of this global pandemic of COVID-19 on our communities, I think it's how we process it. It brings up a lot of different emotions, and some people are confused by that. Some people don't want to go there. So there's like this la 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 la, yeah, not happening, not happening. And for some of those people, it can kind of catch up with us. But whatever we're in, it is going to affect us. And sometimes we actually realize what's going on. Other times it shows up in other ways. So we may not recognize that it's affecting us emotionally, but we may notice that certain things feel different. And it could show up in our bodies. It could show up in things like, oh, our sleep is a little bit off. It could be my appetite is off or my focus is off. It could be any number of things. But again, we're not in a bubble. So as we hear the different things that are going on, as we have things changing, and it could be changes at work, it could be changes in our finances, it could be changes in what's going on with our family, we are all impacted in different ways.
Thanks. I see the Smiths are here. If y'all want to, anytime you can unmute and pop a question in, and glad you are present. We are recording this just so y'all know, so you're not surprised when this pops up on YouTube. So
yes, feel free.
Another question I had thought of was, what are the challenges we are all facing, whether we are aware of it or not? So what are some things that you can see that we're going to feel subconsciously or not?
Right. Well, I think one of the biggest challenges that we're facing right now, well, there are a few. One, this was just in some ways unexpected. I mean, again, this on this level, this is nothing that anybody has anticipated. A number of scientists have said, of course, this is a possibility. We've been through things before, SARS, et cetera. But something of this magnitude is very unexpected. The way that it has impacted us on a global level, on a national level, on a state level, you know, the people on your street level, how it affects your own family. So I think that is one of the things. It's just been so unexpected. And so we were kind of caught off guard. And it's true, we were able to see this happening in other countries, unfortunately, who've also been affected by this. But I think that's part of it. Also, uncertainty. And I think uncertainty is a very, very big piece of this. We happen to live in a region where, you know, come May, June, we hit hurricane season. And we hit uncertainty with that. We know that there's a likelihood or a chance that we could be involved in a storm. And we know with this region, we start to watch the maps and we start to prepare. And yet still anxiety and uncertainty comes with that, especially towards the high peak, you know, towards the end of the summer. The uncertainty with this comes in so many ways. This is new. We don't have a lot of data on it. We don't know how exactly it's spread, how long it lives on things. But on a more personal level, we don't know how it's going to impact us, how it's going to impact our loved ones. You know, people are faced with things like, is it going to affect my job? Is someone in my family going to get sick? And what if they do? And if they do get sick, how are they going to fare? And is there going to be enough medical equipment to take care of them? Will I be able to see them? So there's a lot of uncertainty. And then with all the changes that it brings, we're kind of used to doing things in a certain way. We have our routines. Right. And we have we have a way of life that we know, and our way of life right now has been greatly disrupted. Yeah. And so I think that alone is a really hard challenge for people to deal with. Just having our way of life, we're very fortunate in America to have the freedoms that we do, to be able to move the way that we do, you know, to come and go as we do. And a lot of that, even if the disease is not affecting us personally, for the greater good, we've been encouraged or told, okay, stay home if you're able. And so there's this whole way of life of doing things that is just changed right now. And then there's uncertainty with the future. We don't know the course of this. People, unfortunately, many people are losing jobs, or people who own private businesses don't know if their businesses are going to be able to survive. There's a lot of financial uncertainty. And all of those things bring a lot of stress and anxiety.
Yeah. Well, I'm going to jump in. So how would I manage such sudden and dramatic disruptions to my routine, to my daily life? How would you lead and guide me or others?
The first thing I would say is take a big deep breath and just kind of slow down. Okay. I think for a lot of people, it is that the rug feels like it's being pulled out from underneath us with such big and drastic changes, and it feels overwhelming. And I say stop and take a deep breath. Because unfortunately, when we get stressed, sometimes we actually start breathing differently, and I'll talk about that in a little bit. But it's kind of, instead of letting the brain, because once we start to get anxious and stressed, it does get overwhelmed, and we end up with the what ifs. What if this? What if? What if? And anxiety and the stress and all the changes. I think of anxiety as and worry as what if plus ... negative outcome.
That's good.
Right? It's not what if I win the lottery? What if because of this, I reconnect with 100 new friends? What if I get new business out of this? What if we're all... That's not where worry and anxiety comes in. So I think some of it just taking a deep breath, or having a big cry. It is absolutely okay when we feel overwhelmed to not feel like we have to tamp that down, because sometimes just getting that release then puts us in a place that we can think and function better. Now that's different from saying, I'm going to let yourself wallow in despair. But I will sometimes recommend to people, first of all, acknowledge how you're feeling. It's okay to identify it, that you feel scared or you feel frustrated or angry. And those are not feelings you have to just get rid of immediately. They're there for a reason. Right. Even anxiety is there for a reason. When I'm often working with people and I say, if I could wave, for example, if I could take my pen and wave it and get rid of all of your anxiety, would you want me to do that? And they're like, yes. And I'm like, you would be dead in a week, because anxiety is the thing that helps us look out for threat and danger. And so that is in part why a lot of us are feeling more anxious at this time, because there's an increased perceived threat and danger with what's going on, yet we can't exactly know what it is. So I think, take a deep breath, have a big cry, and then slowly break things down.
Okay.
Almost kind of pragmatically, just very practically, what are the things that I need to take care of first? What are the immediate needs? And really thinking about, okay, in this situation, what is in my control?
Right.
Because there is so much that's not in our control. And if we spend a lot of energy trying to control those things, one, we end up frustrated, and it's wasted energy.
Right.
So we can't control what happens with this disease. We can control our reactions to it, how we choose to respond, how we choose to prepare, how we, there's actually a great, I was on Facebook the other day, and there's a fantastic clip about this, focusing on, with COVID-19, what I can control and what I can't control. And if I find it, I will send it to you. But again, really focusing on, well, what is it that I can control? I think the other thing is realizing you're not going to get it all solved in a day anyway. Right. So being patient, giving yourself permission to be patient with yourself. And patience is something that we have to actually practice. We definitely have to practice. I remember, teaching my son when he was little, when he was about 3, and I said, sweetie, he wanted something right away. And especially when things are changing and we're feeling desperate or we're feeling scared, we want things right away, which is understandable. And he said, Mommy, what means patient? And I said, well, patient is waiting, especially when it's really hard. So again, if we're waiting to cash our winning lottery ticket, or we're waiting and we're going to ride as a ride at Disney World, now closed, but that we're excited for it, that doesn't feel hard. But in a hard time like this, I think giving yourself room to be patient and realize I'm not going to get this all figured out in one day. This is an ongoing process and a changing thing. So I have to give myself permission to focus on what I can focus on right now, to take care of the immediate needs, which includes taking care of yourself, your family, your loved ones, and being planful without panicking.
how are you seeing stress, anxiety, and fear manifesting among some of the patients you see, or even among your friends and family? How's it showing up right now?
In any number of ways, even in myself. I'm human. I'm going through this just like everybody else. And I will say, just because I am a psychologist, a mental health professional, I'm not, these things are affecting me as well.
Yeah.
But I'm seeing a lot of, again, a lot of just changes or challenges with things like sleep. It is harder for people to concentrate or focus on things, even when they do have the time and space to do it, which is more challenging for a lot of people working from home and trying to now teach their kids from home. But there are a lot of physical things that people are kind of susceptible to when they get stressed are showing up. So if you're prone to migraines, you may be having more migraines. If you're prone to stomach aches, so you may notice it physically. In some people, I see just kind of this overwhelming fear and panic, and the sky is literally falling right now. I'm literally afraid even just to go outside my door. And so if you think about kind of the natural bell curve, there are going to be people on either extreme end. There are going to be people who are like, yeah, this is nothing. And then there are going to be the people who stockpile a year's worth of everything, not just toilet paper, and feel like they can't leave the house and, have to kind of air seal everything, which is probably an overreaction. And those overreactions, unfortunately, tend to reinforce the anxiety and just make it feel even worse. Some despair, some just kind of feeling, I think a lot of feeling helpless. A lot of feeling helpless, feeling a bit overwhelmed as well, which again, everything when the life that we know is changing, and not just in one little way. There's a domino effect in all of these things. Suddenly our kids can't be in school. This is a big change.
Yeah.
And then think of all of the collateral because of that. Okay, so they're not in school, then maybe they can be in daycare. Oh no, they can't be in daycare, or daycare closes, or is it okay to have them in daycare? So again, just a lot of the worry that's going in all of these different spheres, and sometimes people not knowing what they need to be. I like to separate out, what do I need to be concerned with or think about and be planful about, and what am I worrying about? And worry doesn't particularly actually do anything, but a lot of people worry because it feels like they're doing something. It feels like we're preparing. And if worrying did something, I'd be the first person to say, okay, let's have a worry party.
Yeah.
I would have all my patients come in who are worriers, and I'd say, okay, let's use the next 15 minutes. What are you worried about? Like, let's focus hard. Yeah. Worry tends to just kind of expend that energy, and it is different from actually thinking. Worry tends to then just take that energy, and it doesn't allow us to use it in productive ways. So there's a difference between, and some of that goes back to what I can control and what I can't.
Yeah.
But I do want to add the other thing that I'm seeing is, two other things that I'm seeing, interestingly. One is there is some more depression, and a lot of that has to do with feeling isolated or lonely.
Yeah.
And as we practice the social distancing, there are more people who don't have the regular contact with people that they do, and they miss that. So whether that's because you can't go in physically to work and see your colleagues, or we can't gather together at Westbury on a Sunday or on a Tuesday or the days that we normally do and have that connection, there's a thing that's missing. And so there's sadness. There's also, and I know I'd sent you an article on this, there's grieving going on.
Yeah.
And I think that's something that people wouldn't necessarily label. And I remember when I came across that article and I was like, absolutely.
Yeah.
And we're grieving in a number of ways. Yeah. So, but the other beautiful thing that I'm seeing is hope. I'm definitely seeing hope. I'm seeing people with a desire to see what they can do for others. And we know it's often, unfortunately, in the face of something negative happening, that we see people coming together and pulling together and reaching out and trying to help each other. We've done that over and over and over in the Houston area with any number of floods, as you know. But it's often a negative thing happening in life that it's almost like it gives us the opportunity or a good excuse to do something. And I think that there's a pull for people to want to be able to do good for others.
That's great. I like you're balancing the depression, which is very real, but the hope that is showing up. How would you advise us, I captured a few, to deep breath, cry, break things down, mission to be patient, and grieve. Are there other ways you might advise us in this time?
Sure. And I'm going to borrow, so one of my colleagues, Dr. Jennifer Hughes, also at UT, did a great interview. I think it was on ABC 13, and she was basically talking about the same thing. And as I was watching her, I was like, So if you get a chance to watch that, she's fantastic. These are a lot of the same things. So one is to try to be more present focused.
Okay.
So worry and anxiety worry tends to be more future focused. That's the what if, and that's in the future. So do we need to be mindful of, think about the future? Absolutely. Do we need to be planful? Yes. But especially once we notice ourselves getting very anxious, we want to kind of ground ourselves and really say, well, where am I now? What can I do now? So you may or may not be familiar with mindfulness practices. And so there are a number of different ways to be more mindful. Or to ground yourself. So one of the things that she talks about that I also use frequently with clients is just a very basic grounding technique. It's called 5-4-3-2-1 grounding. Okay. Nothing that I've made up. It's been in existence. Anybody can Google it. Okay. And it really just takes you through using your physical senses to help you be present in the moment. So for example, it is 5 things that you can see and 4 things that you can touch. And right now, don't go out and touch all sorts of doorknobs and things, but if I'm thinking of 4 things that I can touch this computer and see what it feels like. I can touch, the cloth and see what that feels like. I can touch my pen and see what that feels like. I can, touch my earring. And, 3 things I can hear, 2 things I can smell, and 1 thing I can taste. And sometimes that taste is going to be the inside funky taste of your mouth, but that's okay. But the idea with that is that it takes us away from thinking way in the future or way in the past, because as we're doing that, as I'm noticing what this pen feels like and feeling the little ridges on the pen, I'm very in the moment. So it helps me to get away from, it really just helps to ground me. And I encourage people to practice some yoga or meditation or breathing exercises. There's so many different types of relaxation exercises out there. So I encourage people to do a little research on their own. A lot of them are just very simple breathing exercises. And one of the things that we don't realize is that often when we get stressed, we start to, for example, chest breathe. And then we're like, oh, you know, my muscles feel really tight and I feel like I'm not getting enough air. Now, if you ever just watch a baby breathe, they do this beautiful breathing where their bellies go up and down and up and down. And they're breathing with their diaphragms. Now, when we get stressed, we tend not to breathe with our diaphragms. We tend to breathe with our chests, and it's shallower breathing. So something else that people can look up is just called diaphragmatic breathing. If you Google it, it's going to be on there. People can also find online. I do this with my clients. We look up on YouTube various visualization tracks to take them, you know, if you're like, oh, okay, I like something with a beach scene, and you do a relaxation exercise where you're on a beach scene, you can pretty much find anything. You know, you can actually find dishwasher sounds to go to sleep to. So find what works for you in terms of helping you to feel relaxed. And I encourage people to practice that on a daily basis. So it's not just using it in an emergency when you're feeling stressed, but we are having kind of a chronic stress right now. So there's a difference between an acute stress. This is chronic stress with acute stressors in there. So I really encourage people to practice these things on a daily basis, even if they're not actively feeling it right then.
That's very true.
Exercise is vitally important. Getting outside and getting fresh air. So as far as we know, and again, thinking about a client that I was working with who was like, I just don't even want to go outside. And I think it depends on your environment. If you are in a closed-in apartment unit where if you go in the hallway, you may encounter a bunch of people, then that's a different scenario than if you live someplace where you could safely walk out on your balcony and get some fresh air that way, or take a walk, go to a park. But getting outside, getting fresh air, getting sunlight, and then staying connected. So, you know, we talk about social distancing. I really prefer to think of it as physical distancing while socially connecting. And I think right now, especially, it's really, really important to connect. And there's so many different ways to do it. We are using this technology that I wasn't familiar with before, but it's nice to be, you know, it's nice to be able to actually connect with you and see you in this way. But there are any number of ways: phone calls, texts, emails. There are a number of different apps and programs that you can use to have video chats. So even though we can't get together physically, people are able to get together in groups and still do things. So we may not be able to get together, for example, with a family to celebrate a birthday, but you can have everybody, if they have the technology, and help each other figure out how to set it up. And you can do a virtual party that way. But the making sure that we're checking in with people, staying connected, is critically important. Once we start feeling isolated, it increases the worry, it increases the stress, it increases the depression.
One thing I wanted to ask that I think is really important is, what are signs that my response to these changes is unhealthy? Like when should I seek help, and where can I seek help?
Sure. We all deal with stress in different ways. And some of us have our things that we revert to, little bad habits that are maybe okay for the short term. We definitely see, I was just looking at something, it was talking about the COVID-19, meaning the 19 pounds that people are going to gain while they're all, you know, working from home because of the stress eating. So There are a number of different things that we do to cope. Some of them are adaptive and healthy, and some of them are either less healthy or problematic. So, for example, if somebody is noticing that they're engaging in things that are self-harm behaviors, and this can include anything from literal self-harm behavior, such as cutting or burning yourself. But it can also include things like drinking excessively, picking up habits that, if somebody has had an addiction and they have been abstinent, and they find themselves relapsing, absolutely. But even people who haven't had problem use of substances may see an increase in their use as a way to cope. And there's a difference between a slight increase in use and I need this to self-medicate. I need this to get through the day. That's when we really, really want to be careful. Okay. And I would say with that, of course, consulting your physician. With substance use issues, there's always AA and NA, Alcoholics Anonymous and Narcotics Anonymous. They are actually, I've learned, having virtual meetings as well.
Okay.
And they are very easy to find. Just go online. If you start to notice that your anxiety is way overwhelming, you can't sleep at all, you can't kind of pull it back and get perspective on it, you are excessively over preparing or washing your hands, to the point that they're raw. That again, that's on the extreme end of things. That's not going to be helpful and could actually be harmful. That's another time to seek out getting some help. If you start to pull away from people and start to isolate because you're feeling depressed or despair, if you start to notice yourself feeling really hopeless, and especially with the uncertainty of this, then again, a lot of people losing jobs, people may be worrying about possibly losing businesses. If you notice an increase in despair, so there are a number of different places to get help, and a lot of formats are trying to make themselves available via telehealth. So, and this is, some people have been doing this in a lot of places. This is an emerging practice, but Psychology Today is one source that people can go to. You can look up by region. You can look up by what it is that you want to address, whether it's stress, anxiety, depression, relationship issues, coping with children, all of it.
Yeah.
And these are things that are increasingly coming up, again, with more people being under the same roof for more periods of time, or being separated for more periods of time. Those are things that are stressful. There's something called Mental Health Match that is more within our local area. And UT Health actually has online cognitive behavioral therapy that people can sign up for. So that's just a Google search. I did it myself today just to verify. You Google UT Health online CBT, and it will take you to the links. Now, one other critical thing I definitely want to point out, and I think sometimes people are hesitant to go here, is that some people feel either desperate or hopeless and start to have thoughts of suicide, thoughts of wanting to, it would be better if I wasn't here, for any number of reasons. And this is the case both during a pandemic and not. But it's absolutely something that we want to kind of look out for, be on top of, and not be afraid to talk about. I talk about it with my clients and in my office every day, all the time. And it's unfortunately common for people to have these thoughts at some point in their lives. Being people of faith doesn't make us immune to those thoughts. And that's why some people are afraid to go there, because they're like, well, you know, I'm a person of faith, I'm a Christian, or I believe it's something else, so I shouldn't be having these thoughts. Or people would just tell me, oh, just pray about it and you'll be okay. And while I absolutely encourage prayer, I definitely say that is a time when you need to reach out, communicate with family, with loved ones, tell somebody that you're having these thoughts. And there are two different pieces of information I want to give you. So one is the National Suicide Prevention Lifeline. And that number is 1-800-273-TALK, which is actually 1-800-273-8255. And even if you Google suicide, it's basically the first thing that's going to pop up anyway, which is great. Yeah. For a lot of my clients who have those types of thoughts on an ongoing basis, I often have them program that number into their phone. And they don't have to say suicide prevention hotline. They can call it Al or Betty or whatever they want to, but to have that number handy so that if you're in a moment of crisis, you have somebody. It's 24/7, 365. There's also a text line.
Oh, neat.
Yes, because some people are like, well, I don't want to talk to somebody, but they are willing to communicate. And so that number is 741-741. Oh. And all you need to do is text home to that number. And somebody on the other line will text you back and will commence a conversation with you via text.
Oh. Well, Andrea, thank you for your time first. And is there anything else you want to add for us?
I think, so one thing I would just say is understand anxiety is normal.
Gosh.
Stress is normal. Feeling stressed at this time is normal. So for people who are like, oh my gosh, why am I feeling this way? Well, there's reason to be stressed. There's a lot that's changing. So I don't want people to beat themselves up for saying, well, what's wrong with me? I'm such a strong person. Why am I feeling anxious? Why is my sleep disturbed? You know, why can't I eat the way I normally do? Or why am I stress eating? Again, anxiety is a normal, useful thing. It helps us look out for threats and danger. So don't beat yourself up, but do look for things and write down a list of make a little menu for yourself. What are some things that I can do that help me with my anxiety, including things like, you know, what are physical activities that I could do? Who are some people that I could talk to if I was feeling really stressed? What are, you know, are there Bible passages that I like to go to that are calming or soothing for me? Is there a place that I like to go that helps me to feel? So you make a menu so that at that time, you don't have to just scramble to try to think. Write it down the same way we're writing down a lot of things right now to help keep track of. And then you can just kind of go to your list and again, be kind and gentle with yourself. That is a homework assignment I often, very frequently give my clients, and we need to remember that for ourselves at this time. Be kind and gentle to ourselves and be kind and gentle with each other. And I say that because we are also dealing with other people who are stressed out. And the more kindness and the more compassion that we can have for ourselves and for others, I think will help us get through some of the hardships that we're dealing with this.
Well, I gotta ask, how are you doing and how we can pray for you? You're part of our church family, so just how are you?
I'm human like everybody else, so I'm stressed, but doing pretty well. I am, again, just trying to figure things out like everybody else, with things changing on a day-to-day basis and trying to juggle things working in healthcare in a field where I am taking care of people. I'm not like many of my colleagues on the front lines, literally in the hospital or in the ER. But trying to do that while things at home change. And also, as you know, both of my parents had to have some procedures recently in another state. And, it's hard to not be able to go and be with them. I actually had to cancel a trip that I was going to go see them and help them out after their procedures. But overall, I think I'm doing okay. The sleep is off. It's why I can relate to all of these things, because I'm a psychologist and I'm a human. I'm a mom. I am a daughter. I'm a sister. I'm a worker bee, which I'm glad to be. And I think, so how can you pray for me? Pray for the above, the things that I listed, but also pray for me as I work to continue to help others. This is something I feel very fortunate in my work. I feel like this is what God wants me to be doing. So when I get to do this, I also feel blessed, even though it can be challenging at times. But I certainly don't know everything. So I pray, for God's guidance in helping people and helping me to take care of myself. I sometimes forget to do that.
Yeah. So. Can I end our time in prayer and by offering a prayer for you?
Absolutely.
All right, let's pray. Gracious God, we give you thanks for the wisdom that Andrea has learned and gained over so many years. We give you thanks that she is your child and she is experiencing everything that we are. And we pray that you would be with her parents as they heal. Pray that you would help Andrea be able to connect with them. Pray for her as a mom and as a sister, and for strength through this uncertain number of weeks. And God, we give you thanks for her gifts, for how you have blessed her with insight, and pray that she would be able to provide guidance to everyone she sees, all her patients, that she'd instill wisdom and healing in their lives. And God, also pray that you would help her to take care of herself. We need Andrea to bless this world, and that begins with how she loves herself. Be with us, and we look forward to our reunion whenever that happens, and we trust in you. We pray this in your son's name. Amen.
Amen.
Well, thank you, Andrea.
You are very welcome. Anytime.
All right. We'll see you soon.
All right. Until we can see each other again.
Yeah.